Dr. Farrell Tyson, and we're working today on a live patient who will be receiving a true line lens utilizing the Aura by WaveTech. So the patient has already undergone femtorexis and lens fragmentation. I'm going to give a little bit of lidocaine here. And you're going to see that it doesn't take too long to utilize the Aura along with a standard cataract procedure. I like to utilize a larger rexis for my crystal lens or true line patients. One of the nice things about utilizing Aura is you don't have to mark the patient preoperatively, which saves you time going from one room to the next. Now, Aura likes to tell you to fill the eye with BSS, but I find that it works much better to use a viscoelastic. I use Helon GB because the tube is large enough to get through the whole case. So as you can see, I'm inflating the eye until the viscoelastic starts to come out the wound. So I know I have a full inflated bag and eye. So I'll have good pressure. I want to flush away the excess and give you a nice smooth cornea. I'm going to turn off the light. Let's go ahead and show this down here. I want to lift the speculum up off of the patient's eye. Therefore, I don't have any pressure on the eye causing distortion or induced astigmatism. Go ahead, and we can go back and look over here. So go ahead, I want you to look at the little red light, ma'am. So we want to line up the center. Get the little ball in the middle of the green. You see the little red light?
Mrs. Quest?
Jane?
Oh, sorry.
You see the little red light? Good. Go ahead. Okay. BSS on the cornea. Get this over a little bit more. There we go.
Gene, look at that red light.
Look right through the red light. You see it? Okay, look right through it. Good, there we go. Okay, so what you see here is that the Aura is finding that the axis is very similar, the magnitude is very similar, and now I'm going to go ahead and select my lens. I had chosen a 16, but I like to be a little bit on the safer side, so I'm going to go with the 16.5. And now I'm going to also go with the 2.75 sill that I was expecting. But you can see here's your keratometry saying that you had a 2.07, but actually we're finding 1.85. The reason for that has to do with the posterior cornea and also my incision. Well, if my incision is about 180, I should be inducing more cylinder vertically, but actually I've reduced it because of the posterior corneal sill. So now we're getting the other lens loaded. And what I like to use with the crystal lens or the true line is the capsular tension ring. What I find with that is it helps keep the bag caught so I can hit what I'm aiming for consistently, but also it helps prevent Z syndrome down the road. I like to place that in prior to putting the lens in the eye. Little counter traction. Go ahead and rotate the lens to about where we thought it was going to be placed. And we get a little bit more viscoelastic, so I can fill the bag back up but also push the bubbles out of position. This is a technique that D. Stevenson taught me about doing the rotation under viscoelastic.
Viscoelastic.
Okay, ma'am. You there? Okay, I want you to look at the little red light. Good, go. And it's too good to be true for a live surgery case, but we had no recommended rotation. So as you can see, we only have 0.14 of anticipated sill. We were left with 0.4, so we're going to leave the lens where it's at. As they say, sometimes it's better to be lucky than good. So now we're going to mark the lens like Dee taught me. And now I'm going to take the viscoelastic out. You can see the lens moved a little bit, but I'll just go ahead and adjust it. Match the marks. With other platforms, it's going to be more movement is anticipated with like a one piece. Good. Now I'd like to go ahead and take off the speculum, remove the drape, and reassess with any toric lens because you may have movement or decompression of the eye. So get a little bit more fluid in there. My spots are lining up. And we're done. And as you can see, it doesn't really add too much extra time to your case. Usually about, with a standard monofocal you're looking at probably about an extra minute to 2 minutes with a torque. It usually adds about an extra 3 to 4 minutes. So thank you very much, and maybe we'll be able to take some questions.